you realize that this patient has got microcytic hypochromic anemia, which is basically needs some iron supplement. So you give iron supplement to the patient and ask her to come back after 2 weeks. This question you should be able to answer, that how much hemoglobin is going to improve after 1 month of iron therapy. A word of caution: if I see 10 patients of anemia in my surgical outpatient department, unfortunately 1 to 2 patients out of 10 patients having anemia do not have simple iron deficiency anemia. They have some other blood disorders. So you should not simply ignore this fact that by doing a CBC and a low hemoglobin level, every patient has got microcytic hypochromic iron deficiency anemia. So this is not true. So you must keep your eyes open when you are seeing patients in outpatient department, and try to look at the complete CBC report and make sure that this patient has no other blood disorders. So if you have few weeks available, then start oral iron therapy. If you have few days or few hours left to do the surgery, then you transfuse the blood to that anemic patient. How much hemoglobin improves with 1 week of iron therapy? The answer is 1 gram per deciliter should improve in 1 week of iron therapy. And how much hemoglobin will improve after 1 unit of blood transfusion? The answer is the same, 1 gram per deciliter. Now comes to the per-operative blood loss. In my clinical experience, the common mistakes are very common, and it is very unfortunate that some residents have got a very casual attitude while they are getting trained at a junior level. They don't follow the instruction in a very crystal clear way. Procrastination is an important word. You should understand what it means. I repeat, procrastination. I will not tell you the meaning of this thing. You better look into the dictionary if you are not aware of this word. But this is an unfortunate state of mind which leads to mistakes which can put the life of the patient in danger. The common one is when the patient is going on to the operation table and about to be intubated, and you are told that the blood has not been arranged, or if it is arranged, the quantity is not enough. If I tell them to arrange 4 units of blood, they tell me on the morning of the operation that only 2 units have been arranged. This is not happening very frequently, but when happens, it can create havoc for the patient and for the whole of the surgical team. This is very important considering the scenario in Pakistan, that blood is not ready when required. A very recent incident happened in the hospital when the patient started bleeding from a very vascular tumor in the head, and the patient relative gave 4 to 5 units of blood, if I can remember, but unfortunately when he started bleeding, the blood was not ready. Why? Because the cross match sample was not sent in the morning. So sending the cross match sample to get the blood back from the blood bank and to start transfusion normally takes approximately 1.5 to 2 hours. So you can see the patient can lose his or her life very easily if blood is not ready when it is required. And most hospitals and clinics in Pakistan are not equipped with a terminology called massive blood transfusion. Unfortunately, the patients who are going in neurosurgery operation theatre or in cardiovascular operation theatre or maybe in other surgeries where the blood loss is expected to be severe or unexpectedly severe during the surgery, they will need massive blood transfusion. So a surgeon should aware of this terminology and he or she should know how to deal with it, how to arrange for blood and how to transfuse blood and how to avoid complication and how to treat the complication of massive blood transfusion. Definition of massive blood transfusion: it is transfusion of volume of blood greater than recipient's blood volume in less than 24 hours. So by definition, if the patient has got 5 liters of blood in total, for example, and you have given 7 liters of blood to the patient in 24 hours time, that means that you have given massive blood transfusion to the patient. I repeat that again: transfusion of volume of blood greater than recipient's blood volume in less than 24 hours. So this is the volume, normal volume of the patient, and this is the volume you have transfused to the patient in 24 hours time or less than 24 hours time. So this is massive blood transfusion. Generally speaking, the causes of profuse bleeding during surgery is the disease itself or trauma or surgical intervention. They are basically the reasons of having a profuse bleeding. So what happens when you transfuse blood to the patient which is more than the volume of the patient in 24 hours time? You get failure of hemostasis due to lack of factor 5, 8C and 9 and platelets. And what do you have to do? You have to give him fresh frozen plasma 1 to 2 units to correct coagulation abnormalities. So remember that after massive blood transfusion, you must give fresh frozen plasma 1 to 2 units to correct coagulation abnormalities. FFP should also be given prophylactically after every 10 units of blood, and transfuse platelets when platelet count is less than 30,000. So remember, when you are transfusing such a huge amount to the patient, you should check the laboratory investigations after every 12 hours or after every 6 hours, and then make sure that the patient has got adequate amount of hemoglobin and other factors like platelets. And remember, fresh frozen plasma should be given to correct coagulation, and it should be given prophylactically after every 10 units of blood. What can happen to the heart when you transfuse such a massive amount of blood? Blood is always kept at a very low temperature. So low temperature, high potassium, low calcium and high citrates in stored blood can lead to ventricular fibrillations and ventricular extracycles, which can lead to cardiac arrest. So very important point to know that you should warm the blood before transfusion. There are blood warmer available, but unfortunately not in all of Pakistani hospitals have got blood warmers. But you should warm the blood. There are certain other ways to warm the blood, and you can slow the rate of transfusion if something of this sort happen, like patient goes into ventricular fibrillation or ventricular extracycly or into cardiac arrest. Autologous blood transfusion. What is autologous blood transfusion and